Good afternoon, everyone, and welcome again to the Multicultural Media Online, here hosted by the New South Wales Health, Multicultural New South Wales, and the Multicultural Health Communication Service. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and we're really happy that you've joined us again today. We'd like to begin by acknowledging the traditional owners of the land from which we're all meeting today. We pay respects to elders past and present, emerging, and extend the respect to Aboriginal colleagues and also the elders from all multicultural groups represented today. We would like to request if you can please keep your microphones off, on mute, and please send through your questions on chat while Minister for Multiculturalism, Natalie Ward, and Deputy Chief Health Officer, Dr. Marianne Gale, give their updates. And we'll start by opening remarks from Minister. How are you?
I'm very well, Jess. Great to see you again. Hi, everybody. It's wonderful to be with you. Thank you again for joining. I, of course, acknowledge the traditional custodians and pay my respects to elders, past and present too. I'll jump right into it. Now that we are heading towards that fantastic goal of 90% fully vaccinated, which is just such an achievement. I'm so proud of everyone. It's been great to see everyone out and about in the fresh air, in that sunshine, and enjoying getting out and about and doing what we love to do. I'm really proud of the multicultural community and all the work that everyone has done to make this possible, including the crucial support of our religious and community leaders. Thank you so much. Plus, of course, the critical role played by multicultural media. You have done so much in delivering the vaccination messages and getting that information out. It's been so important. I've mentioned before the vital contribution our great interpreters and translators have made as well. Your role in helping reach so many corners of our communities during the COVID pandemic cannot be overstated. And I actually really am just conveying that to all of my cabinet colleagues and everyone in government about how important it's been and how much we appreciate it. Because Multicultural New South Wales has translated more than 1,200 translators and interpreters who play such a valuable role, and they just quietly get on with the job, getting that information out in language, which is wonderful. But got a great announcement today, Jess. We are looking for more people to join our ranks. We've seen how important the role of translators and interpreters has been during the pandemic, and we would like more. So we are supporting the training of up to 100 interpreters this year as part of our commitment to train 400 new interpreters over 4 years. I hope we don't have another pandemic. We don't need anything like that again, but they are vitally important interpreting services that we need and translation services for everything else that we do in our day-to-day lives. So applications for the New South Wales Interpreter Scholarship Program are now open for people who speak in-demand languages to become qualified practicing interpreters. Now, there's no doubt our interpreters are the voice of our multicultural society, and I'm calling on the next generation of those interpreters. So I urge anyone that speaks the priority languages and is interested in a career in interpreting to apply for the latest round of this outstanding scholarship program. For more details on it, you can go, of course, to the Multicultural New South Wales website, and I encourage you to get on there quickly and have a look at that opportunity, because we'd love to have you. We're also looking to recognise the outstanding work of those of you who have been promoting social cohesion and unity during this challenging time. During our this year, we have our Peak Multicultural Awards program for New South Wales. So nominations are open for the 2022 Premier's Multicultural Community Medals and the Multicultural Honour Roll. That's been a tradition of our premiers for many years, but it's very exciting this year, and I just can't wait to meet all of those who are nominated for those community medals and the honour roll. And this year, we're very excited that the awards program will pay tribute to our renowned Italian-born Australian fashion designer, Carla Zampatti, through the Carla Zampatti Arts and Culture Medal. I did speak with the family and asked their permission, and they were very supportive of this way to recognise her important contribution as one of our leading multicultural beautiful fashion designers. So it's a great awards program. I know many of you are very familiar with it. It's our chance to acknowledge those everyday multicultural heroes in New South Wales who we rely on every day, day in, day out, in our courts, in our hospitals, in our health system, and of course during COVID in so many ways to support our communities. Those medal categories honour the achievements of community members working in diverse fields, including youth, business, arts and culture, as well as regional communities, very importantly. So we're really looking forward to thanking our community for their incredible efforts at our 2022 Premier's Harmony Dinner. We weren't able to hold the dinner this year, but we will be holding it in 2022. I have that in, and we're really excited to be able to hold that once again. At that event, the Premier's Harmony Dinner, the New South Wales Premier will posthumously recognise the legacy of people who have made lasting contributions to New South Wales through the Multicultural Honour Roll on the night, because we know that 2021 has been an incredibly challenging year. So I'll finish up on that point, Jess, but if you know someone who you think should be recognised, please do go to the Multicultural New South Wales website for more details on how to nominate. I'll hand back to you now, Jess. Thanks.
Thank you so much, Minister Ward. And it's great to see and hear all those good announcements. And we'll make sure that we send out some emails on that and share that with our networks. Dr. Gale, how are you today?
I'm very well. Thank you, Jess. And good afternoon, everybody. Nice to be here. Nice to see you all again. So in terms of an update from me, we continue to see relatively stable case numbers, relatively low, which we're pleased about, and we do hope to keep it that way. And we thank everybody for being so conscientious and going out to get your vaccination, and for taking steps to follow the public health advice as restrictions ease, and for maintaining that caution as you go out and about for yourselves and for your families and for your community. In the 24 hours till 8 p.m. last night, we had 304 locally acquired cases of COVID-19. And sadly, we reported the deaths of 3 people, 2 gentlemen and 1 lady who passed away. As Minister Ward said, our vaccine rates are good, and gives us a lot of optimism that we can continue to achieve even higher vaccination rates. So as of Monday night, across New South Wales, we had 93.2% of people aged 16 years and over receiving a first dose, and 85.5% being fully vaccinated. And we're also really pleased to see rapidly increasing vaccination coverage in our young people aged 12 to 15 years, who now are at 78.3% first dose and 53% fully vaccinated. And we know that having our young people vaccinated from that 12 to 15-year-old age group is particularly important to help reduce transmission more broadly in the community, as well as to ensure that schools can continue to safely operate and minimise the risks of any disruptions due to COVID in these next weeks and months. So a big thank you to those young people and to those families for coming forward for vaccination. I'd just like to particularly urge anybody out there who hasn't yet had their first dose, but particularly your second dose. If you've had 1 dose and you're not sure whether to get your second, I do really encourage you to book in for your second dose. There are many opportunities now to access vaccination through pharmacies, through GPs, through New South Wales health clinics. That second dose is very important. So if you've had your first, please do go back and get your second dose. And also, I'd like to also remind people in the community who may have had COVID, and we know that that's a growing group of people who have experienced COVID. And if that's you or somebody that you know, someone in your family or in your community, encourage them to get vaccinated. They don't need to wait. Once they are fully recovered, once they are feeling better after having COVID, they can get vaccinated, and we encourage them to do so. So that's probably all from me for the moment. Thank you, Jess.
Thank you so much, Dr. Gale. And thank you for those people, for those journalists who have sent through your questions. And please continue to add your questions onto the chat and we'll get them answered for you. Minister Ward, we'll start off with this question. What are the latest changes to the Service New South Wales app?
Thank you, Jess. A great question, everybody. Look, residents across New South Wales, we know, can now integrate the COVID-19 digital vaccination certificate into your Service New South Wales app. I did it on my mum's phone the other day for her, and it was just really great to have one point that you could use to check in with your QR code and at the same time have that proof of your vaccination. And we know we're also used to checking in everywhere we go. It's a really simple way to do it. So that will hopefully make things easier for people as we go about our lives and return to everyday life out and about. The integration of the two, we hope, is a very user-friendly way to not have to click between various apps. You should be able to just have the New South Wales app, their Service New South Wales app there. New South Wales, of course, is the first jurisdiction in Australia to roll out an integrated QR code solution for displaying that vaccination status. And I'm really proud of us leading the way with that, so that now when you visit a venue, you can just show your green check-in tick with your vaccination status immediately. And that saves the staff at a venue time, it saves you time, and you can get on to doing your shopping or going to your restaurant or your movie or whatever you're doing. So while we've integrated that digital certificate, it's an optional thing for you to integrate it if you want to. You can still keep them separate if you'd like to, and it's an optional thing, but it certainly is the easiest way and quickest way to prove that you're fully vaccinated, but entirely up to you if you want to integrate the two or not. The statewide rollout of the app follows our pilots, which we did in regional areas deliberately just to have a test and trial program that was done in clubs, in aged care facilities, and in taxis of all places in Port Macquarie, Tamworth, Wagga Wagga, and Lismore, as well as our internal government participants. So I just want to thank everybody for participating in the trial, and particularly in those areas, for their great work. That's now rolled out to everybody, of course. And so as the only thing I'd say is that vaccine data sits, of course, with the federal government, with the immunisation register. And so to integrate that into the New South Wales Service New South Wales app, you will go to your federal MyGov account. So you will need to go there first and either set that up or access that. It's linked, and you can link it to your Medicare status. You can download the Express Plus Medicare app. That app, and then you sign in with your MyGov account details. And then you go into select proof of vaccinations and then view history. And you can select share with check-in app and then Service New South Wales. It's so self-explanatory, even I can do it. So it might sound like lots of steps, it really isn't. If you just get that MyGov account in place, and once you've done it once, then it's on your app and it's easy to go. You can also get on the app COVID-19 case alerts. So they are, in addition to the contact tracing by New South Wales Health, which we know is world leading and has done a great job of keeping us all safe, you'll be contacted directly by New South Wales Health if you need to isolate through the app. So it's that one source of truth that is designed to be user-friendly for everybody. And you'll be soon getting push notifications from Service New South Wales alerting you to any potential contact you might have had with a COVID-19 case, as we expand the ways that we try and keep our residents and our community in New South Wales informed. So those notifications are enhancements to our existing COVID-19 features. It should make it easy to identify. If you've been to a venue on the same day as a positive case, you'll be able to see that. You'll get a red icon in your check-in history, and you'll see that there's something going on there, enough to alert you straight away. It's a really quick and efficient way to get that information out very quickly. So according to New South Wales Health, when residents receive that notification or see that case alert in their check-in history, you just need to monitor for symptoms. That's all you have to do, and get tested if you feel unwell. So you'll see that pop up there. You just need to monitor for symptoms, keep an eye out, and if you feel like you are unwell, go and get tested. And those notifications will start on Friday of this week, Friday the 29th of October, and then you'll be able to get that information all in the one spot. So very exciting. I'm really pleased that we've been able to pull that together, and thank you to everybody that's already registered. And it should be a reasonably simple process, but bear with us. If you're having any challenges, call Service New South Wales or Federal Government MyGov. Thanks, Jess.
Thank you so much, Minister Ward. And 2 days to go, Friday, and we'll get that information. But also, for any resources in languages, please visit newsouthwales.gov.au, and you can find resources that can provide you that information in your language. Dr. Gale, we have a question here about the booster. What's the latest news on the booster and the third dose of the vaccine?
Thanks very much, Jess. Yes, firstly, to explain the difference between a third dose and a booster. So a third dose is what we refer to mainly for people where they might have an immune condition in many cases. That means that when you give the normal 2 doses of vaccine to people as what we call the primary course, when a person has those 2 doses, their immune system doesn't quite respond to the same level as somebody else's. And so a group of people who might have immune systems that are weaker because of various medical reasons might need what we call a third dose to have the same effect on their immune system. So we usually refer to the third dose in the context of people who have weakened immune systems. And so recently, the federal government announced that third doses were available to people who have who meet the criteria of particular conditions where the immune system is affected. And those people should see their doctor to talk about getting a third dose. So I would encourage anyone out there in the community who might have an immune condition and what we call immunocompromise, and that might be because you take certain medications that suppress your immune system, or maybe you've had certain types of cancers, particularly blood cancers, or some more rare immune conditions, which you would probably know about. If you think you fall into one of those categories, please talk to your GP about getting a third dose to make sure that you have the best protection against COVID as you can. So that's the third dose. When we talk about booster doses, that's really an additional dose for people who have completed what we call the primary course, which is for most of us 2 doses, and for people who might have suppressed immune system, the primary course might mean 3 doses. So a booster dose is an additional dose on top of that. And so people will have seen perhaps the announcement today that the Therapeutic Goods Administration in Australia has approved the use of booster doses for people in Australia aged 18 years and over. And there's still some further advice to come out from ATAGI, which is the federal government, federal agency that provides advice as to how to best use vaccines in this context. And so they're hopefully going to provide some additional advice soon. But what we understand from the federal government is that booster doses are probably going to become available to people in Australia aged 18 years and over from the 8th of November is my understanding. And we understand that there's going to be more information forthcoming about that. We understand that Pfizer is probably going to be the vaccine that's used to give booster doses, and that it's going to be recommended mostly for 6 months after you've completed your first 2 doses. So that's news from today, but more information still to come from our federal government agencies around exactly more details around accessing the booster dose.
Thank you so much, Dr. Gale. It's good to know the difference between a third and a booster. So a question here, Minister Ward, from Viola Calvert from Radio Tagumpay, which is Filipino media. From December 1, are businesses required to accept unvaccinated customers and also have employees who are unvaccinated? What is the impact on their duty of care for other staff and customers?
Yeah, thank you, and hi to all my Pinoy friends out there. Thank you for the wonderful question. Look, it's ultimately, we are saying that we are providing the QR code with the integrated information that I spoke about, and we encourage businesses to ask for people to obviously comply with the check-in requirements at their businesses. They also have to provide, of course, look after their own staff and provide a safe workplace to those staff. But also we are saying this is up to the individual, and the obligation is on the individual to comply with those health orders and comply with the public health requirements for production of proof of vaccination to enter premises, same as events and same as a whole range of things, which has been very clear from our pathway. We've set that out so that everybody knows this is the pathway forward. and that, you know, those businesses that are opening up, are providing services and goods and have staff employed, we want to keep those communities safe, and we want to keep customers safe and patrons safe, so that we can all follow those orders and emerge out of this in a very COVID safe way, as in accordance with the health advice. So ultimately, we do ask that businesses who are very good at asking for check-in, and they're entitled to do that, but we do say to individuals, it is your obligation to make sure that you're complying with those orders. So please do so, and please have some courtesy to those staff who are just doing their job to keep everybody safe.
Thank you so much, Minister. A question from Bushra Alabaidi. Dr. Gale, why, in your opinion, is there a spike, the very large numbers of Delta cases, in spite of the high percentage of vaccination, which is 73%? This is a question from Bushra.
Okay, thank you. Well, we know the Delta variant is highly transmissible, but what we are seeing in New South Wales is lower case numbers. We have seen that decline, and we have seen them in recent weeks quite stable at that lower level. And as I said earlier, we're hopeful that we can keep it that way. And there's a lot of effort going in to continue to increase vaccination rates, and also to maintain our contact tracing response so that we can keep the numbers of cases low, even as we continue to progressively open up. And so that's really our aim. The Delta variant, as we know, and as overseas has shown us, is highly transmissible, and we need to continue to maintain vigilance and go cautiously. We have seen in some countries overseas a tick upwards, and in some ways it's surprising. So, for example, in Singapore, where they have very high vaccination coverage and still many measures, including masks, they have seen quite an increase in cases and an increase in hospitalizations as well. So we're looking very closely at the experience of different countries overseas so that we can learn, and to make sure that in New South Wales we go cautiously, we go carefully to try and avoid any spike. But at the moment, as I said, we have relatively low numbers, we're relatively stable. It's really pleasing to see our vaccination rates continue to increase, and we'll continue to take cautious steps forward.
Thank you so much, Dr. Gale, for that. Pawan Lutra has a question for you, Minister. Great to note your basketball skills on the weekend. Now, why is the date of birth necessary and the vaccination certificate, and what value does that add when a person wishes to enter a restaurant?
Oh, thank you to my friend Pawan. Great to hear from you again, and wonderful to see everybody. Thanks, Pawan. It's a very good question. Look, I have to say I'm not entirely sure. I think it's a federal issue to do with the vaccination certificate itself. I'm sure there's a very good health reason to have that there, other than for people like my son, who is probably just trying to show proof of age, but that's not in relation to the vaccination certificate itself. Look, we want to keep everybody safe, and that's the main priority. So it's probably just part of the integration, but I will get an answer for you on that specifically as to why that might be assisting. But my assumption is it's a health requirement to do with the vaccination status. And thank you for the basketball skills. It was wonderful to be with the Premier out at Hornsby Spiders as we reopened community sport. And I was a bit shocked when he said we're going to play a bit of basketball. And so I had to quickly have a brush up on my skills and run up. Finally, I got 2 baskets in, thankfully, and didn't slip over or embarrass myself. So I got through it. Thanks very much.
2 basketballs, that's pretty good. Well, there's a question here for Dr. Gale. Will booster shots become compulsory? Is this meant? This is a question from Natalie.
Right. Look, not at this stage. Again, once boosters become available, and we're really pleased with that announcement, we'd certainly encourage everybody to get them. So it's just news off the press today. And the main message for people out there is go and get the vaccines that are available to you now. So that's your first dose if you haven't had it already, and your second dose if you haven't yet had your second dose. That's the main aim for the moment, and particularly for the weeks ahead. A really important message, particularly for our young people, our 12 to 15-year-olds, to continue to come forward. And anyone who's had COVID and is now feeling better, please go get your vaccination.
Thanks so much, Dr. Gale. A question from Sandra Gonzalez. For international students, Minister Ward, this is for you. For international students, is there an opportunity to apply support similar to what was available previously with accessing superannuation? And I believe there was support for international students.
Yes, that's a great question, and we're so excited to for our international students that are here, but also to welcome back our international students. Something that we've all been talking about for some weeks. It's really important to us. We have been very conscious of supporting international student welfare throughout the pandemic. It's something that we heard early on that we needed to do, and we're very happy to do so. We had support with crisis accommodation for 6,300 students. We had up to 20 weeks of crisis accommodation because some of them that were stuck here and couldn't get home at the outset of the outbreak. So we did that through purpose-built student accommodation and homestay providers. So thank you to all of those. We also, of course, distributed 50,000 food hampers to our international students, and I just want to thank Food Bank for their collaboration with us on that. We also had the Redfern Legal Centre providing free legal advice to our students through the International Student Legal Service and the app, the Legal Mate app. And so we knew that those that needed to access that information could do so through the Redfern Legal Centre. And I want to thank the lawyers there who were so helpful. We also, of course, supported the Sydney Community Forum to launch that international student intake support service. So that was to help connect international students to the various support services across those 60 community organisations that were in place there as well. But we also, in terms of financial support, made up to $400 a month available in emergency financial relief for those international students, and that was in partnership with Red Cross. And I just want to thank Red Cross for their wonderful work during that time. So we've wrapped around our wonderful international students, and I'm pleased that we could do so.
Thank you so much for that, Minister Ward. Dr. Gale, a question here about the rapid antigen testing test. Will there be soon available in supermarkets, and will I still need to go for the usual COVID-19 test at a testing clinic?
Thanks, Jess. Yes, look, the rapid antigen tests are becoming increasingly available in Australia. And yes, soon they will be on supermarket shelves. And I think we are all learning about how this new technology introduced and now becoming more available for people, how we can best use that as a community to help manage early diagnosis and to manage risk. One of the key things is that the rapid antigen test is a very useful tool, but it's not perfect either. And so as people use rapid antigen tests, what's really important is that if you do get a positive result from it, you still do need to have a normal PCR test, which remains still the best way to pick up a true COVID-19 infection. So rapid antigen tests, I understand, are being used by different workplaces, are very important in protecting our aged care facilities and have a role in a number of different situations. And I think we're still learning collectively together about how we best use them when they're more broadly available to the public so that we could buy it from our local supermarket. But a really important message is that if you do have a RAT test and it is positive, it's not quite as good a test, or what we call a sensitive a test, as the PCR test that everybody is now used to. So it's still important to have that test. And the main message at the current time is still for anybody out there in the community, irrespective of whether you're fully vaccinated or had one dose or are unvaccinated, if you have even the mildest of symptoms, it's still very important to go forward and get a standard COVID-19 test without delay and to stay at home until you get your result. So that's the key message for the moment. And we're still going to have to learn as rapid antigen tests come into our midst going forward. So it'll be an interesting time ahead. And again, as I mentioned earlier, a lot that we can learn as well from other countries overseas that have had RAT testing available for a longer period. And we're certainly looking to the experience of our colleagues overseas.
Thank you so much, Dr. Gale, for that. A last question from Minister Ward, and I'm sure a lot of people are asking, what will be the changes for international visitors from New South Wales?
Thank you.
To New South Wales and to Australia.
Yes, yeah, very exciting. How many times have we spoken about this previously? We were looking forward to some information on this, and here we are. So from 1 November, we have seen the federal government has removed the need for those wanting to travel from Australia, so wanting to leave Australia. Previously, you had to ask permission to do so. You no longer have to do that from Monday, from that 1 November date. We're very excited. If you are fully vaccinated, you won't have to make that application, and I'm really pleasing that people can travel back overseas if they want to, provided they're double vaxxed. Those who are unvaccinated will still have to ask for that exemption if they want to leave. And it was pleasing that last night the Health Minister, Greg Hunt, changed that determination so that that anyone could leave as they wanted to from 1 November, provided you're fully vaccinated. So you'll need to provide proof that you are fully vaccinated, and that's with a TGA approved vaccine. So of course, those ones that Australia recognises, and you have to have had that second dose at least 7 days prior to travel. So get the 2 doses in, and you won't have to fill in those forms. And that's the first stage of the international reopening from the federal government, which is great. The second stage, of course, is allowing international students and critical workers back into the country, which we know, and particularly our regions have been waiting for, our universities and education institutions have been waiting for. So for those who haven't been vaccinated, you'll still have to apply to leave and to let them know why you want to travel. But those who are not will have to undertake that 14 days in hotel quarantine. Arrivals from overseas, of course, coming back here, just need to have proof that they have received that TGA approved vaccine, and they have to undertake a PCR test before they board a plane in the country that they're coming from. But we work with the pleasing news is that in New South Wales, you won't have to quarantine if you have that proof that you're fully vaccinated. Anyone coming back in to New South Wales, if you're not fully vaccinated, will still be required to enter that hotel quarantine for the 2 weeks, and there's only 210 spots per week for that hotel quarantine. So we are encouraging everyone to get vaccinated if you want to leave, and to have proof of that vaccination if you want to come back home again.
Really great news, Minister Ward. Thank you for that update. And Dr. Gale, any last words? It is 4:30 again, we're over time, but thank you, Minister Ward, and thank you, Dr. Gale. But any last words for our Multicultural Media Online?
Thank you, Jess. Look, I think the key messages, as I've talked about earlier, is again, a big thank you for people to come forward for vaccination. Please continue to do so. Please continue to get tested. And I'd just like to end by particularly mentioning and asking for vigilance from people in our regional areas. We have seen in recent weeks increases in cases in our regional areas, particularly in the Hunter, New England area and along our Victorian border. And we know that Victoria is seeing quite an increase in cases. And so if you live in the regions, please do be vigilant as well. And I know that, to date, you haven't had to deal as much with the high numbers of cases as metropolitan Sydney, but it is really important if you live in the regions to be vigilant. Please get vaccinated, and please get tested if you have symptoms. Thanks.
Thank you so much, Dr. Gale. Minister Ward, any final words?
Yeah, thank you very much. I can just echo Dr. Gale's comments. Please remain vigilant. We've done such wonderful work to get to where we are. I also just wanted to come back on the question about birth dates on the vaccination certificate and the requirement for proof of date of birth. That's a federal requirement, and it's the Australian Immunisation Register that is requiring that be on there. So again, I'm not quite sure why, I'm not a health person, but that is a federal requirement. So that's why that's on there. But I think, Parwin, in your case, it's just to prove that you are as young as you look. They can't believe you're so young. So just proving that you're old enough to get into the venue. That's all it is. Thank you, everybody.
Oh, thank you so much, Minister Ward, and thank you so much, Dr. Gale, and thank you to you all for joining us every week here at the Multicultural Media Online Forum, and we really value your questions, and we make sure that we can answer your questions. For any recordings of this session and all the other recordings, please visit the New South Wales Multicultural Health Service website. Thank you again, and we look forward to seeing you again next week.
Thank you.
Take care.